So now for the next rare disease condition which we'll be discussing, we'll get to talk about what is a Kennedy's disease. Kennedy's disease. So what is a Kennedy's disease? Of course, it's all those disease conditions that will actually affect the neuromuscular system, okay, the way your nerves and your muscles actually communicate. So it's also known as a spinal or bulbar muscular atrophy. So it's an adult onset X-linked recessive neuromuscular disease. It's caused by mutations in a gene known as the androgen receptor gene, and it leads to progressive weakness of the muscles, and the person can be shaking. There's a whole lot of tremors. Okay, so that's it. So it causes a lot of issues on different systems. So please, you can pause to look at it, right? So causes and genetic factors. Is there's a mutation in the gene known as the androgen receptor gene on the X chromosome. So there's expansion of the CAG trinucleotide repeats in exon 1 of the androgen receptor gene. So you have about 9 to 36 repeats. So that's normal. But in Kennedy's disease, the repetition are so much, so you're having about 38 to 60 plus repeats. Okay, so it's X-linked. So males are usually affected, females are usually carriers. So clinical features: there's progressive weakness and wasting of the proximal limb muscles, bulbar involvement. There will now be dysarthria. The way the person is speaking is slow. Then even then when the person wants to swallow something, there's issues there. So there's gynecomastia. The person's breast is enlarged. Okay, male breast enlarged. There's an issue. Testicular atrophy and infertility. Please pause and observe this slide. It's very important. These are like the signs and symptoms. So other signs: there's reduced reflexes, slow progressive course, and all of that. So you diagnose this from clinical suspicion, looking at genetic testing, electromyography. Okay. So management: there's no cure. It's a genetic stuff. Okay. As of the time of recording this video, there was no cure. Okay, so physical therapy for mobility, speech therapy, nutritional support, because the person is finding it difficult to actually swallow. So they're actually doing some research on some anti-androgen therapies to see if it will actually help. Okay.